Hey, this is Doug Field, along with my co-host Brent Macy. Welcome back to this segment of Healthcare Consumerism Radio. We have joining us today representing one of our partners in our forum initiative to build out our program content and, engage more employers with us at IC Forum Expo is Don Betts with Employers Like Me. Good morning, Don.
Good morning.
How are you?
I'm doing well, thank you.
Good to have you here. Give our audience kind of a overview of Employers Like Me and your mission statement.
Well, thank you, Doug. We appreciate the opportunity to join you all today. Appreciate the partnership with IHC. Employers Like Me really is all about partnering and collaboration, and it came about due to some discussions that several key, what I would call kind of thought leader employers around the state had back during Governor Perdue's administration. And things kind of percolated along, and the employers really liked the opportunity to be able to get together amongst themselves and network and share some of the things that they were doing and learning, kind of in an environment that didn't include a lot of other health providers. And so they continued that. Georgia Tech got engaged, and they asked us to help staff the opportunity, and we came up with a concept of Employers Like Me. And essentially, it's all about peer-to-peer learning, connecting, and networking the employers with other employers. At Tech, we've done a lot of work with peer-to-peer learning, and it seems that most of us learn best from stories that we hear from our fellow colleagues that have a similar type job. So that's what the whole premise is. And so the idea is to find all the cool things that are happening around that employers are doing around health innovations and making sure that other employers learn about them.
Yeah, and while you're primarily in Georgia right now, you're not going. You have plans to go beyond Georgia in the future, correct?
Yeah, it's like innovative thought doesn't stop at the county or state line.
Right. Yeah, Don. So you had mentioned Georgia Tech. What is Georgia Tech's exact involvement with Employers Like Me?
Well, we're sponsoring the group right now, providing staff and some of the backbone for it to help pull things together. And there's a real important piece because one of the main items that these folks are interested in is to be able to make good decisions. They need data, and of course that's right up the alley with Georgia Tech. And so we've got some interesting things going on now around health technology in our extension group there, led by Margaret Wagner-Dahl. We're very interested in working with these employers and making sure that they've got good data to be able to make the best decisions. So
when you have these groups together, and you mentioned collaboration and storytelling is one of the best ways to really think through some ways to solve some problems. You mentioned data. What are some other things that the employers that are members of Employers Like Me, what are some other things that they're focused on?
Well, we've got several topics right now that have been pretty hot. The on-site clinics, and really let me back up and look at that one more 30,000-foot view, and that would be access to care. We've got a lot of employers that are out in the state, some of them in rural areas, and even some of them in very busy urban areas, and getting their employees quickly to the right care is difficult. And so we've seen a lot of discussion around how to do that. And when I say on-site clinic, my definition of that has been expanded greatly. It's everything from telemedicine and telehealth, which Georgia, frankly, is a leader in that regard, and then such things as maybe partnering with a local hospital for a nurse practitioner for a couple hours every morning, all the way to a beautiful, full-blown, full-deal on-site clinic with several full-time providers.
Yeah, Don, we've got Docs for Patient Care involved with us in Forum as well. And, it's interesting because I had them on a call the other night, and they really were zeroed in on the problems in rural Georgia and access to care. So I think, it's a big, big problem. And it's going to increase as more docs kind of, retire and go away. Some hospital systems shut down in rural Georgia. So I think it's a big pain point for employers and their employees.
Yeah, and that kind of leads into one of the other topics that there's a lot of discussion about, and it's really what I would call kind of coaching your employees through the system. especially because sometimes, as we said, it's difficult to find the right folks, the right providers in a convenient way.
Mm-hmm.
So what a lot of employers are doing is that they're putting programs together, and a lot of great vendors are helping them with interesting programs to make sure that their employees find the best care, at an efficient price.
Mm-hmm.
And so a lot of discussion about that.
Don, when you look at access to care, how much of the ACA is factored into the access to care decision for employers?
I don't know that I'm a good one to answer that. We most of the folks that we're dealing with are the larger self-funded companies.
Mm-hmm.
The ACA in that regard really hasn't been the driver.
Right.
Okay.
They were already concerned about this and working on it.
Right.
So with employers like me, I know you have a really good group of members there. Kind of what's the sweet spot of your membership?
Well, it's amazing. I never am on a phone call with more than 2 or 3 of these people, or never at a meeting with them when there's not a wonderful exchange of ideas and information. It's just phenomenal. It's a great group of people. Most of these folks are just extremely open, and they're very willing to share. So, really the takeaway for this is that Employers Like Me is about helping your fellow employer to learn from your stories and experiences that you've had. And that's really kind of what we're all about. There are so many other organizations out there that do a great job with the content and the expertise, and we're not trying to duplicate that. What we're really trying to do is figure out ways how to connect these folks so that they can learn from each other.
Any size company, Don, can join?
Yes,
Okay.
yes.
Okay.
And, again, if you look at our list of our board members, most of them are larger folks, but we're trying to do some content for some of the smaller companies and even the fully insured folks. Matter of fact, we're having a workshop in rural Georgia, in Douglas, Georgia, southeast Georgia, on April 17th, and it's primarily for some of the regional, smaller companies, and we'll have some discussion there to help them with some of their decision-making and strategy, but we're also going to be talking to them a lot about another hot topic, of course, is wellness and prevention, and how we kind of wrap that into the company's, actually even into the company's safety program, looking at all of that as one. So we're going to talk about wellness, we're going to talk about access, and then we're going to talk about this coaching. So, yes, we would encourage smaller companies to join the group. And right now there's no fee. It's just a matter of, reach out to one of us and let us know you want to be included.
Now, some of your members include Rubbermaid, Racetrack. What are some of the other members of Employers Like Me?
Well, some of the folks that we all recognize, Chick-fil-A, Southwire, 2 great, Georgia companies. But we've also got representatives on our board from Procter & Gamble. We've got a CEO on our board from Sunset Foods Farms down in Valdosta.
That's excellent.
Yeah, and Fieldale Farms up in northeast Georgia, Denise Ivester. Again, these folks, you've heard some of these names before. Gary Rost with the Savannah Business Group. Most people in Georgia don't realize that we probably have one of the most outstanding business coalitions on health in the whole nation, and that is the organization that Gary runs down in Savannah called the Savannah Business Group. They've been doing the coalition thing for about 25 or so years. They've got about 25 companies, about 45,000 covered lives, and I use them as an example of how businesses working together and collaborating really can move the needle in a positive way in their community for health.
Now, one of the things to our audience out there that was attractive to the IHC and partnering with Employers Like Me is what you're hearing, is that the employers out there have a lot of different pain points, and getting them together and having them, really talk through some of the things that worked, some of the things that didn't work, was one of the things that really attracted us to create this partnership. And thanks to Don and his team with, setting up some of the workshop tracks that are going to be driven by Employers Like Me, and Employers Like Me is going to actually have an exhibit booth at the conference, so that if you're interested as an employer and want to join employers like me, you can swing by and talk to them. Coming up on some of the workshop tracks, Don, I know it's all about collaboration, and a lot of these employers that you work with are going through the health and wellness. Is there a lot of talk about consumerism in the meetings that you're having with these employers?
Oh, yeah, and they may not necessarily call it by that, but I think that's what it gets back to. It gets back to educating the employees to make better decisions all the way through, as far as wellness and prevention, and then all the way to the point of treatment. And so there's a lot of interest in trying to make sure that there's effective communication, there's enough information there, and encouraging that employee to take some accountability and responsibility and interest in their health.
Don, what's the discussion among the membership about private exchanges and defined contribution?
I will be honest with you. That's something that everybody's kind of quietly looking at and trying to figure out. And I don't think that we've necessarily broken the code on that yet. So some of the stuff that you guys are doing on that and putting all the information together that y'all have assembled, I think is going to be very helpful to the employers.
When you look at any discussion around the federal and state or the federal exchanges with the employers at all?
A few are talking some about that, but again, we really haven't talked too much about that. I think people are they got their head down trying to make sure they got everything in line for right now. And of course, one of the big things right this moment are just the ACA reporting regulations that just came out. And, we're probably going to have a webinar early June that will be led by one of our employers to kind of talk about how they're handling that. But that's been most of the topic.
Mm-hmm. Now, when you look, we got about a minute and a half left on the show. Kind of wrap this up in a bow for our audience here on how they can join employers like me and how they can contact you and get in touch with your group.
Well, again, we really appreciate the opportunity to be on here, and we appreciate the partnership, the ongoing partnership with IHC. And Employers Like Me, I think, is a good one to partner with. We're really trying to bring together some innovative thinkers that we have out there in the state and these employers. They're out there paying the bills for most of the health care in the state, and so they're really being innovative, and they're really working hard at it. And our goal is to connect them with resources, connect them with each other as one of their main resources so that they can do a better job, and we create a healthier workplace and a healthier Georgia. And, all they need to do is go to our website and hit contact us. It's www.employerslikeme.org, or just give me a call, Don Betts at 912-381-9003. And we'll get them linked in with the information flow so that they can start participating.
Well, Don, thank you so much for joining us on the program. We really appreciate the partnership. And to the rest of our audience, stay tuned for the next segment of Healthcare Consumerism Radio.